Is it alright if you marry at an age past your sexual drive? Marriage is a magnificent and sacred institution. What destroys it? Wrong selection of partners, unrealistic expectations, adjustment issues, abysmally low tolerance, and failure to understand the boundaries of marriage. Marriage is said to be the happiest year all of us commit. The factors that are responsible for reducing the age gap are good education, decent job, financial independence, good physical and mental health. Success depends on mutual love, understanding and cooperation, similarities in attitude, and ability to compromise, and faith in the preparedness of a spouse. The boy is expected to be older than the girl. This is traditional acceptance and possibly has a scientific bearing. While hormones play a role, it's not always clear how much a difference do they make. But other factors, psychological, social, and physical, also work together to create your libido. Testosterone is high in your 20s and so is your sex drive. But it's also a time when you could be anxious about sex because of inexperience, and this might be the reason why 10% and more men in their 20s report erectile dysfunction. Men continue to have strong sex drive through these years. Testosterone starts to decrease around age 35, going down by about 1% every year, and this could have some effect on your sex drive. You may be more fertile in your late 20s than your 30s. In females, the desire might go up just as fertility starts and decline towards the end of 20s. For many men, the stress of work, family, and other commitments can affect how interested you are in sex. Women in 30s and early 40s, this time of life may be when your sex drive is strongest. Women between 27 and 45 had more frequent and intense sexual fantasies than younger or older women. Men in 50s and beyond, maintaining a good physical and mental health is a hallmark of enjoying a sex life. Erectile dysfunction becomes more common as you age, but it's not age that causes the problem as much as the health worries that become more common with age. The heart diseases, diabetes, high cholesterol, obesity, and the drugs that treat them are the main culprit. It's not only testosterone. You need testosterone to get aroused, but it's not clear how much. Half your age plus 7 rule. It states that one should never date anyone under half his age plus 7 years. For example, a man of 42 can date a girl of 28 years plus, but not younger. It may not be wrong to do this, but it's not advisable. What's a high sex drive? There is nothing called a normal sex drive. It is subjective and varies from person to person. How you feel and how much you discuss sex with your partner may be different with different couples. A couple of things that affect the entire sexual urge. Number one, you have high sexual desires and you are satisfied with your partner. In this case, it is still normal and okay. Number two, despite having sex, either you are unsatisfied or feel that the amount of sex you are having is low, or in the worst case scenario, willing to sacrifice your work, social or sleeping time to enjoy sex, you are in deep trouble. How does sex drive change with age? Age is a likely determinant of sexual drive. Both men and women start a decline in sexual behavior as they age. The highest level is usually found in adolescence. It declines in old age. Hormonal changes are probably one of the most important biological factors for sexual behavior. Hormones potentially trigger sexual desire. Androgens and estrogen play a significant role in activating sexual desire and helping to enjoy sex. Physical health. Illnesses reduce sexual drive regardless of age. In older adults, chronic disorders harm sexual function. Medications. Some prescription drugs have erectile dysfunction and other sexual problems as a side effect. For example, some antidepressants and antihypertensive medications cause a reduction in libido. Psychological influences, our expectations, attitudes, sexual knowledge, and past experiences all influence sexual drive. Relational influences, the death or absence of a spouse leads to a complete cessation of sexual intimacy. Couples have a relational problems. Marital unhappiness is another common cause of loss of sexual desire. Sexual behavior is different in males and females. Men do not have menopause as women do, but their testosterone levels decline as they age. This reduction starts by 40 years and continues to go down after 70 years. In women, there is a significant reduction in hormone production after 50 years. Postmenopausal women have a complete or almost complete depletion of estradiol production, and this leads to various changes in their genitals. More specifically, women with low estrogen levels undergo atrophic changes in vaginal tissues, that is, vaginal atrophy. Vaginal lubrication reduces significantly. This affects the ability to enjoy sex, and vaginal dryness causes discomfort and pain during intercourse, compromising sexual drive. Does aging necessarily mean a lower sex drive? Well, yes and no. Aging is associated with a reduction of sexual drive, but there is no direct relationship and there are exceptions to this rule. Other factors have a stronger relationship like hormonal changes, medications, physical health and psychological factors. It depends on the couple's physical health, lifestyle and beliefs about sex after aging. It also depends on the chronic diseases, medications and circulating sex hormones. Tips to improve your sex life in your 50s and beyond. Here is a list of recommendations you can try or discuss with your doctor. Don't be afraid to engage in sexual activity. Find solutions if you feel pain or discomfort and experiment with different positions. Foreplay is important. Habituation is the main problem of many couples. You can turn around this problem by giving more importance to foreplay. Before penetration, appropriate foreplay also contributes to lubrication. Stop seeing penetrative sex as the only alternative. Consider hormone replacement therapy. In some cases, hormone replacement therapy is the best solution for sexual problems, and this is particularly the case in older men with low testosterone. So in conclusion, sexual pleasure in older couples should not be a taboo. They can still enjoy great sex after midlife and there is nothing wrong with it. There are certain obstacles to sexual relations in older adults like health problems. In some cases, they have psychological or relational factors interfering with their sexual relations. But what causes a decrease in sex drive could be more complicated than the explanations offered. Regardless of age, one can regain a healthy sex life by following a few guidelines. Coming to our original question, is it alright if you marry at an age past your sexual drive? The age gap does not matter when there is a mental maturity, love, understanding and compatibility. Different age gaps work differently for couples. The single rule is not applicable. Thanks for watching.